The day in the life of a PIDS ID doc varies, and that's the best part of our job. Every day is different, every day is exciting and fun. I'm a jack of all trades, so it's great. Some days I'm doing my research and I'm in the lab, and other days I'm seeing patients on the floor, and then sometimes there's an outbreak and I'm doing infection control. So every day is something new, and that's the best part of our job. So I knew I wanted to go into PEDS when I started medical school. And when I got on my PEDS rotation, it was PEDS ID. And so when I finished the rotation, I didn't know if I wanted to do PEDS or really wanted to do PEDS ID. So I made sure to do multiple rotations when I was in residency. I realized that I really just love this field. And I realized what is it about it is that it's just curative. When you see a patient, you could say to them, I'm going to treat you and this is going to be over. You're going to go on with your normal life for the most part. And when we can't cure it, the treatment is very effective and they live happy, normal lives. So you can go into your job and see a patient and feel like, you've met that challenge and that you've done the best for them that you could possibly do. And I just love that about our field. Certainly, I think all of us in medicine love patient care. When you see that child come back from being critically ill to hopping down the hall, running out the door, there's not a better feeling. Certainly also our patients too. You'll see them for a stretch of time, and then later on in life they'll send you pictures of themselves and they're going to prom or even just going to kindergarten, and there's a great satisfaction in knowing that you played a huge part in making them better. But I also really enjoy my research because on that side of things, it's always some new challenge and something new happening and something you have to read and learn about. And I think most of us who go into ID like that kind of adrenaline rush that's associated with it because it's intellectually very stimulating. Balancing being a parent and a wife along with being a doctor has probably been the greatest challenge in my entire life. But what I've learned in the short time that I've had to be all three is that you have to take a break from one so that you can be good at the other. And so I make sure that I keep them as separate as possible, and I make time for each thing separately. My mentors are still my mentors from the time I was in residency and fellowship to the time now as a junior attending, and it makes me a little emotional because they're like parents, and for my entire career that they have always been there for me no matter what is going on. And I know that 20 years from now, I can still call on those same people when I'm in a situation or I have a challenge. And I think that they have helped me tremendously down my pathway by whether it was a phone call to someone else or helping me figure out a patient that was challenging, or whether it was my research. I couldn't figure out what was going on, and I call them and they tell me, did you try this? Did you try that? And that relationship that you have with your mentors is lifelong. So I guess to answer your question, they've helped me in every facet of my career, but they haven't stopped helping me yet. What I would say, if you want a good balance of career and family life, if you want to be challenged every day that you go to work, if you want to really enjoy your job as a doctor, that this is probably the field for you. Some people refer to us as the specialist, and that's because people like to consult us, because generally we're happy, we like to talk, and we like to help. And I think if you have that kind of personality, which many of us do in PEDS, and you love the challenge of medicine, the combination is what ID represents. So I would say to anybody who's interested in being a doctor who's fulfilled every day and who really enjoys seeing kids and really enjoys caring patients, that this is probably the field for you.